Welcome back, everybody. Today we're going to be diving into a topic that seems like everyone's got an opinion on: cannabis use among cancer patients. But how much do we really know beyond all the personal stories and the headlines? I'm excited to dig in.
Yeah, it's definitely one of those topics where personal experience often overshadows what the science actually says. So I'm really interested to see what the research has to say.
Me too.
Yeah.
And you've given us quite the stack of research articles here, 7 different studies, all about cancer patients and cannabis. What exactly are we hoping to find in all of this?
Well, the goal is to really try to separate fact from fiction. We're going to dig into who's using cannabis, what their reasons are, and what the science tells us about the good and the bad, benefits and the risks. Then we're also going to look at the money side of things because, healthcare costs, those are a big deal. And we'll even talk about the role of doctors and nurses and everyone in healthcare in all of this.
Okay, so let's start with the basics then. Who are these patients using cannabis? We see it's about a quarter of cancer patients, but it's not just one type of patient, right?
Absolutely not. One of the most interesting things that jumps out from these studies is how diverse the group of patients using cannabis is. I mean, there are people of all ages represented, though it seems like younger patients are maybe a little more likely to use it. But really, we see people across all income levels,
Oh,
different
yeah.
education levels, all ethnicities. It really shows that this is not some fringe thing.
Yeah, and it gets even more interesting than that. One study actually specifically looked at the differences between Hispanic patients and white patients who weren't Hispanic. And guess what? They found differences. Their reasons for using cannabis were different. And even the way they talked to their doctors about it was different. It's almost like culture plays a part too.
It just goes to show how important it is to really consider each patient's individual background and their culture in healthcare. I mean, imagine being a patient and feeling like your doctor just doesn't get you or your experiences. That could prevent you from getting the care you need.
Makes you wonder how many people are out there who want to talk to their doctor about cannabis but are too afraid to bring it up. But okay, let's get into why people are actually turning to cannabis in the first place. Pain management is a big one, which makes a lot of sense, but these studies show it goes so much deeper than that.
Well, yeah. I mean, think about it. You get a cancer diagnosis, it turns your whole world upside down. Suddenly, you've got all these physical symptoms you're dealing with. On top of that, you have all the emotions that come with a cancer diagnosis. And then on top of that, sometimes the treatment itself makes you feel even worse. So these studies show patients using cannabis to deal with anxiety, to help fight depression, to help them get some sleep. It's like they're trying to get a little piece of control back in their lives in the middle of all the chaos of having cancer.
One study even called it reclaiming agency, which I thought was a really powerful way to put it. And speaking of agency, the ways that people are actually consuming cannabis is pretty amazing. We're talking pills, lotions, smoking, vaping. People are doing it all. It's not just about smoking a joint anymore.
It really shows how people are getting smarter about their health and taking things into their own hands. They're not afraid to try different things to find out what works best for them.
Okay, so we've talked about the good stuff, but let's be real for a second. There are risks, right? I mean, as much as some of these studies talk about potential benefit, there's also this sense of, well, what if,
Yeah.
hanging over everything.
Oh, absolutely. It wouldn't be right to talk about this without acknowledging that. And, some doctors and nurses and other healthcare providers have very legitimate concerns about cannabis. Things like sedation, confusion, even patients having a bad reaction with their other medications. It just shows how much we still have to learn.
Especially since cannabis is still federally illegal here, which really throws a wrench into research efforts. It's almost like we're stumbling around in the dark a bit.
It's true. We need way more research to really understand how cannabis interacts with different cancers and different cancer treatments. Until then, patients and their doctors have to make decisions without all the facts.
And it's not just the medical side that's tricky. There's also the money part. These studies show that patients often have to pay for cannabis out of their own pockets. Can you imagine dealing with a cancer diagnosis and having to worry about whether you can even afford this potential way to feel better?
It's a huge problem. One of the studies we looked at estimated that patients were shelling out something like $100 to $300 each month for medical marijuana. And that's on top of all the other costs that come with a cancer diagnosis.
And we can't forget about the fact that most insurance plans don't cover this. One study that focused on patients in the Minnesota Medical Cannabis Program found that even if the patients weren't directly paying, it often fell on family or friends to cover the cost, which is still a huge burden.
Yeah, it's like this ripple effect of money problems that reaches even further than the patient themselves. And it really makes you wonder, are we creating a system where only people with money can benefit from this.
It's definitely a really complicated issue with no easy answers.
No kidding. And since we're talking about complicated things, let's talk about doctors and nurses and everyone else in healthcare who are stuck in the middle of all this. It seems like they're being asked to be the gatekeepers of medical cannabis, but most of them don't feel like they even know enough about it to help their patients. I think the research showed less than half felt comfortable even talking about it, right?
Yeah, you're right. And only a tiny, tiny percentage, like 13%, felt like they really knew their stuff when it came to cannabis. I can't say I blame them, though. With cannabis still in this weird legal limbo, there's just not a lot of good, solid research out there to support them making recommendations one way or the other. They're taught to use evidence-based medicine, but when it comes to cannabis, that evidence is still pretty thin. Some even admitted to just relying on news articles instead of medical journals. Yikes.
That's scary. It just goes to show how big this challenge is. How can we expect healthcare providers to give good advice when they're just as lost as everyone else?
It's true. It's like they're walking a tightrope. And it's not just about their medical knowledge. Their reputation's on the line, too. Some of them even said they were worried about recommending cannabis because it might hurt their careers.
I get it. There's still a lot of stigma around cannabis, even among doctors.
But here's a little bit of good news. It looks like things are changing. One study found that most healthcare professionals, something like 80%, thought their patients could actually benefit from medical marijuana. And almost 2/3 said they believed it was safe for their patients. That's huge.
That is huge. It seems like the medical community might be starting to come around on cannabis.
Yeah.
Makes you wonder what's causing it, though, you know? Is it because society is more accepting of it now? Or maybe it's because they're hearing more and more stories from their patients about how it's helping them? Or maybe it's a bit of both.
It's probably a little bit of everything, especially because now more than half of the U.S. supports legalizing marijuana in some form. And with more states legalizing medical marijuana all the time, patients are feeling more comfortable bringing it up with their doctors.
And that's where things get really interesting. In states with medical cannabis programs, doctors and nurses become like the gatekeepers. Patients need them to get access, so it's super important that they actually know what they're talking about and have the resources to help.
Speaking of interesting things, we found some curious patterns in the research about who's using cannabis. One study showed that younger patients and those without a college degree were more likely to use cannabis after a cancer diagnosis. Makes you think, right?
Definitely. It makes you wonder if certain groups of people are turning to cannabis as an alternative because they can't get traditional treatments or because they just don't know enough about their options. Maybe there's a knowledge gap there.
That's a great point. And it's not just about who's using it, but also how helpful different groups find it. Like one study pointed out that white patients were more likely to say cannabis helped them, while black patients were less likely to say they used opioids. So interesting, right?
It just goes to show how important it is to remember that everyone's experience is different, especially when we're talking about something like cannabis use. You can't just lump everyone together. We have to be aware of the different perspectives and motivations people have.
Like pieces of a puzzle, each one showing a different part of the picture.
Exactly. And speaking of different pieces, there was one study that took a closer look at cancer patients who were using cannabis along with other substances.
Yeah, this one was done at a cancer center in Florida that's part of the National Cancer Institute. Just a little FYI for anyone who doesn't know, NCI stands for the National Cancer Institute. Anyway, at the time, Florida allowed medical marijuana, but not recreational.
Interesting. So what did they find out about those patients using cannabis and other things at the same time?
Well, it turned out that those patients were less likely to think that cannabis had any negative effects, like making it hard to drive or concentrate, compared to people who weren't using other substances.
That's kind of worrisome. Could it be that the other substances were masking the negative effects of the cannabis so they didn't even notice them or weren't concerned?
It's definitely something to think about. And it really highlights how important it is for doctors and nurses to be upfront with their patients and talk to them about all the substances they're using, even if it feels a little awkward or uncomfortable.
Totally agree. Honesty is key. At the end of the day, it's about keeping the patient safe and making sure they're getting the best care possible.
For sure. Speaking of honesty, something else that stood out to me was how people were finding out about medical cannabis. I mean, sure, some hear about it from their doctors, but this one study showed that a lot of them were getting their info from friends, family, the internet, even the people who work at the dispensaries. Talk about a mixed bag.
It just shows you how badly people want information, but also how there's no single place they can go to get reliable information. I mean, who knows how accurate or trustworthy the stuff they're finding is.
It's like trying to find a needle in a haystack of misinformation.
Exactly. And this is why research like the stuff we're looking at today is so important. We need to get rid of this knowledge gap and make sure people have access to information that's actually based on evidence.
Knowledge is power, as they say, especially when it comes to your health. Okay, get this. One of the studies we looked at actually focused on the quality of the information, specifically patient self-reporting in that Minnesota medical cannabis program we talked about earlier. I'll be honest, my first thought was, wait, are we seriously questioning whether cancer patients are telling the truth?
Not at all. It's more about recognizing that whenever people have to report on their own behavior, especially with something like cannabis that's still illegal in a lot of places, the data might not be perfectly reliable. Like people might want to make themselves look better, so they might not be totally honest if they think they'll be judged.
Right, they don't want to get in trouble or anything.
Exactly. And that's what's so cool about this study. They didn't just take the data at face value, they actually checked to see how accurate it was.
And the good news is that, for the most part, the self-reported data actually lined up pretty well with the program's records. Age, race, gender. When they enrolled in the program, their cannabis purchases, it all matched up.
That's a relief. It means we can probably trust what people are telling us in these surveys about their cannabis use.
There was one little hiccup, though. Patients were less likely to admit they were on Medicaid than what the program's records actually showed.
Interesting. Maybe there's some stigma about being on Medicaid, even if you're answering a survey anonymously. It makes you think about those social and economic factors we were talking about earlier.
Definitely. The researchers also noticed that older patients were more likely to respond to the survey, which is something to keep in mind when we're interpreting the findings.
Good point. It shows how important it is to think about potential biases in any research, like who's participating, who's not, and how could that affect the results.
It's like that saying there are three kinds of lies. Lies, damned lies, and statistics.
Okay, well, maybe not that bad, but you're right. It's a good reminder to be careful about how we interpret data and always look at it with a critical eye.
Speaking of looking at things critically, get ready for this one. One of the studies used something called item response theory to figure out how cancer patients view the benefits and harms of cannabis.
Ugh, item response theory. It's a really cool tool, but I'll admit it can be a bit hard to wrap your head around at first.
Exactly. Can you break it down for us? What is it?
Basically, it's a way to dig a little deeper than just asking someone if they agree or disagree with something. It's about understanding how strongly they believe it. So instead of just saying, yeah, I think cannabis can relieve stress, item response theory helps us understand how much they believe that. Is it just a passing thought, or is it something they're absolutely certain of?
I get it. It's like you could have a cup of tea or you could chug an energy drink. They're both drinks, but they have completely different effects on you. So what did they learn using this item response theory thing?
Well, they found that people generally saw way more potential benefits from cannabis than harms. It's like the good stuff outweighed the bad stuff in their minds.
And what were some of the biggest benefits and harms they found?
Well, not surprisingly, pain relief and stress reduction were big on the benefit side, which lines up with what we've been seeing in the other research. And on the other side, people were worried about cognitive problems, like having trouble thinking straight.
It really makes you realize how badly we need more research in these specific areas. Like, can cannabis really deliver on all these promises of pain relief and stress relief? And what about the effects on thinking and memory, especially for people with cancer who are already dealing with so much?
Right. We need to separate the truth from the hype. And that's where rigorous scientific research comes in.
So this item response theory thing, it sounds like it could be a game changer for future research, right?
For sure. One of the best things about it is that you can use it to compare different groups of people, even if they didn't answer the exact same questions on a survey. It's like having a universal translator for people's beliefs and attitudes.
That's amazing. It seems like it could really help us untangle this whole cannabis thing.
You got it.
Okay, so we've covered a lot of ground here. Who's using cannabis, why they're using it, potential benefits and risks, the legal hurdles, even the financial side of it all. But there's one more thing we need to talk about, how what people believe about cannabis affects how they actually use it.
It's interesting, right? Her beliefs can really influence our actions.
Absolutely. And one of these studies, which, by the way, had over 3,700 cancer patients, really dug into this. They wanted to know how people's opinions of cannabis, both good and bad, affected whether or not they decided to use it.
Wow, with that many people, they were bound to find something interesting. So what did they find?
Well, buckle up, because this is the big one. Patients who believed in the benefits of cannabis were 5 times more likely to say they had used it since their cancer diagnosis. 5 times. That's huge.
It really is. It just shows you how powerful our beliefs can be, especially when it comes to our health. If you believe something will work, you're way more likely to at least try it.
And on the other hand, the more risks someone saw, the less likely they were to use cannabis. Which, I mean, makes sense, right? If you think something is dangerous, you're probably going to stay away from it.
Totally. It shows how important it is to talk about those perceived risks. If a patient is concerned about cannabis or has the wrong idea about it, we need to give them accurate information so they can make a good decision.
Like they say, knowledge is the best way to fight fear.
Couldn't have said it better myself. And you know what? The researchers in this study actually used a really cool way to visualize this whole relationship between people's beliefs about cannabis and whether or not they used it. They used something called a directed acyclic graph.
Okay, I gotta be honest, that sounds a little intimidating. What in the world is a directed acyclic graph? Is it as complicated as it sounds?
It might sound complicated, but it's not too bad, actually. Basically, it's just a visual way to show how different things might influence each other. Think of it like a flowchart for cause and effect.
So they use this flowchart to see what things might be driving both people's beliefs about cannabis and their likelihood of actually using it.
Exactly. And they found a whole bunch of factors that play a role. Things like age, income, race, even whether someone had used cannabis before their cancer diagnosis. It just shows how our beliefs and actions don't exist in a vacuum, you know? They're shaped by all these different individual and social factors.
It's like this big web of influences all connected.
Exactly. And it just goes to show that this issue is anything but simple.
It really isn't. It's complex. There's so many layers to it, and it's changing all the time.
You got it. And that's what makes it so fascinating to learn about.
So we've done a lot of digging into the factors at play here.
We have.
We've got this whole scientific side of cannabis, the money part of it, the social aspects, and of course, all the ethical dilemmas that patients and healthcare providers are facing.
It's a lot to untangle.
It really is. It's like peeling back the layers of an onion.
And just like with onions, this topic can definitely make you cry sometimes. But seriously, it's this complexity that makes research so important.
Couldn't agree more. We need solid evidence, not just opinions or anecdotes.
Exactly.
Speaking of evidence, one study actually took a really unique approach to understanding how cancer patients see the benefits and harms of cannabis.
Oh yeah, are you talking about the one that used that item response theory?
That's the one. I'll admit, the first time I saw that term, I was like, wait, am I reading a scientific study or a philosophy book? But once I understood it, I was really impressed with how insightful it was.
It's one of those things that sounds way more complicated than it really is.
Right.
It's basically just a way to measure how strongly someone believes in something, not just whether they agree or disagree.
Right. So it's like, instead of asking, do you think cannabis can help with pain? You'd ask, on a scale of 1 to 10, how much do you believe cannabis can help with pain?
Exactly. It gives you so much more information about how people really feel.
So much more nuanced. And what was interesting is that this study found that patients seem to see way more benefits from cannabis than harms.
That's right.
So in their minds, at least, the good outweighed the bad.
It seems that way. Even though they knew there were potential risks, it seems like they were more focused on the potential benefits.
Which makes sense, right? I mean, if you're dealing with something as serious as cancer, hope can be a really powerful motivator.
Absolutely. Of course, that's not to say we should just ignore the risks.
Of course not.
It's more about understanding this complex balance between hope, what people believe the benefits are, and how they make decisions for themselves.
Yeah, it's like weighing the pros and cons, but with all this added weight on the pro side because of the emotional impact of dealing with cancer.
Exactly. And this is why it's so important for patients to be able to talk openly and honestly with their healthcare providers.
I couldn't agree more.
Patients need to feel safe talking about their hopes and their fears and their reasons for even thinking about cannabis, even if they're just looking for information.
And healthcare providers need to be prepared to have these conversations with their patients in a way that's both compassionate and based on evidence.
Exactly. Now, on a slightly different note, there was another study that really caught my eye because it looked at something we haven't really talked about yet. Quality of life for cancer patients who use cannabis.
Oh, yes. That was a fascinating one. They actually followed patients over time to see how using cannabis affected their overall well-being.
Right. And what did they find? Was there a difference?
There was. The study actually found that patients who were using cannabis said their quality of life improved significantly.
Wow, that's really something.
They had less pain, they slept better, and they even said they felt more optimistic and emotionally resilient.
That's incredible. It's like cannabis might not just be helping them manage their symptoms, but it's actually making their lives better while they're dealing with cancer.
Right. And think about it. If you're sleeping better and you're in less pain, you probably have more energy for the things you enjoy, which then affects your relationships, your work, how you see the world in general.
Exactly. It shows you how connected our physical health is to our emotional health and our social lives.
It's all connected.
Now, obviously, we can't draw any big conclusions from just one study,
Right. Of course not.
but these findings are definitely interesting enough that we need to look into this more.
I agree. I'd love to see if these results hold true for different groups of patients with different types of cancer.
Me too. And that takes us back to our need for more research, which seems to be a recurring theme in our deep dive today.
It really does. It's like the more we learn, the more we realize how much we don't know.
That's the great thing about science. It's all about constantly learning and discovering new things.
Well said. Earlier we were talking about all the different ways people are using cannabis now. Well, one of the studies actually took a closer look at these different methods and the potential benefits and drawbacks of each one.
Oh, right. It's like there's a million different ways to use cannabis now. You've got your oils, your edibles, vaping, smoking, creams. It's a lot.
It really is. And each one has things to consider. Right.
Exactly. Like if you smoke or vape, you tend to feel the effects faster, which can be good if you need quick relief, but there's also the risk of lung problems.
Right. And if you eat it, it takes longer to work,
Yep.
but the effects can last much longer, which could be helpful for chronic pain or if you're having trouble sleeping.
Exactly. It's all about finding the right approach for each individual person.
Absolutely.
And that's why it's so important for patients to have good information about
Mm.
the different ways to use cannabis so they can choose what makes sense for them and what they prefer.
It's about giving patients the power to be in control of their own health care.
Yes, 100%. And speaking of empowerment, one study looked at something that doesn't get enough attention when we talk about cannabis, the role of caregivers.
Oh, that's right. Caregivers are like the unsung heroes in all of this, aren't they? They're the ones giving emotional support, going to all the doctor's appointments, and often helping to make really tough decisions.
Absolutely. And this study showed how challenging, but also how rewarding caregiving can be when cannabis is part of the picture.
They found that a lot of times, caregivers ended up becoming like cannabis educators, researching different types of cannabis dosages, how to use it.
It's like they become amateur pharmacists.
Right. And often, they had no idea what they were doing at first, so they really had to learn as they went.
It makes you realize that we need to support caregivers more, you know?
Yeah.
They need access to the same evidence-based information that patients do.
I completely agree. They're a vital part of the care team.
They really are. Okay, shifting gears a bit here, one study we looked at dug into the relationship between cannabis use and opioid use among cancer patients.
Yeah, that's a hot topic these days.
For sure. Some people think cannabis could be a good alternative to opioids, especially for pain, while others are worried about how they might interact or if there are other unintended consequences.
It's definitely complicated with no easy answers.
No kidding.
Well, this study found that a lot of cancer patients who were using cannabis were also using opioids, but there was a smaller group who said they were using cannabis instead of opioids.
Interesting. So for some, cannabis might be an addition to their pain meds, while for others, it's a replacement.
Exactly. And the study found that people who swapped out opioids for cannabis often did so because they had fewer side effects, they were worried about addiction, or they just preferred something more natural for pain relief.
It just goes to show that there's no one-size-fits-all answer when it comes to treating pain.
Totally agree.
Everyone is different, and patients need to be able to explore different options with their healthcare provider.
Couldn't have said it better myself.
Now, I know we've talked about a ton of stuff already, but there's one more study I want to touch on because it's about something really important to me. The whole legal and regulatory mess surrounding cannabis.
Oh yeah, the legal side of things. Talk about confusing.
Tell me about it. But we have to talk about it because it affects everything from how much money goes into research to whether patients can even get the products they need.
This study looked at all the challenges and opportunities that come with having different cannabis laws in each state, some for medical use and some for recreational.
It's like the Wild West out there. Every state has its own rules, which can make things super confusing for everyone.
It's true. And this study found that because the federal government still hasn't legalized cannabis, Research is being held back and is creating all these problems for patients and healthcare providers.
Like what? Give me an example.
Well, for one thing, since cannabis is still classified as a Schedule I drug, there are all these rules and regulations that make it really hard for researchers to get their hands on it to study.
It's like they're trying to study a rare book that's locked away in a vault somewhere.
Exactly. And because there's not enough research funding, patients end up suffering too.
How so?
Well, without enough research to know for sure what the benefits and risks of cannabis are, healthcare providers are less likely to recommend it to their patients, which leaves patients on their own to figure things out.
It's like a vicious cycle. We need more research to make better policies, but the policies we have now make it difficult to do the research.
I go with the chicken or the egg dilemma all over again.
Right. And this study argued that if the federal government would just legalize cannabis, or at least reschedule it, it would solve a lot of these problems.
It would definitely create a more level playing field and allow for better research, which would then help everyone make better decisions.
Exactly. Now, I know we've thrown a ton of information at you today,
We have.
but hopefully you've come away with a better understanding of all the complicated issues surrounding cannabis use in cancer patients.
It's definitely not as simple as some people might think. And every time you think you've got an answer, it seems like 10 more questions pop up.
That's true.
But the important thing is that we're having these conversations, looking closely at the research, and fighting for policies that put patients first and are based on evidence.
Couldn't agree more.
It's kind of like we're at this crossroads when it comes to cannabis and cancer care, you know. We've got all these stories, people are changing their minds about it, but there's still so many questions. The research isn't clear, and the laws are all over the place.
It really does feel like we're exploring uncharted territory, exciting and a little scary at the same time.
That's a great way to put it. And for someone who's just been diagnosed with cancer, I can't even imagine how overwhelming all this uncertainty must be. It's one thing to read about studies, but it's a whole different ballgame when you're the one facing these decisions in real life.
Absolutely. It's easy to get lost in the data, but we can't forget that there are real people behind all these numbers and studies, people who are dealing with real struggles.
People just like you listening right now who just want answers, who want relief, who want to feel like they have some control when everything feels so uncertain.
Exactly. And even though we might not have all the answers right now, I think what we've learned today should be a call to action for everyone.
A call to action to do what?
A call to learn as much as we can, to ask questions, and to be advocates for ourselves and the people we care about.
I love that. So where do we even start?
It starts with those questions. Just like you came to me with all those research articles, keep digging. Don't be afraid to question things, to look for different points of view, and to talk openly and honestly with your healthcare providers, even if it feels a little awkward sometimes.
Yeah, even if it's not always easy to talk about.
Exactly. Remember, the more you know, the more power you have. The more you understand about cannabis, the good and the bad, the better equipped you'll be to make good decisions for yourself, decisions that feel right for you.
And don't underestimate the power of sharing your story. Talk to your doctor, talk to your loved ones, even think about participating in research studies. Every voice makes a difference.
Every single one. It's like we're all working together to solve this big puzzle, and every person's experience is a piece of that puzzle.
That's such a great way to think about it. So as we wrap things up today, I want to leave everyone with this thought. You are not alone.
Even though the research might not be there yet, there are people who can help you answer your questions and make this whole cannabis thing a little less confusing, especially if you're dealing with cancer.
So if you're feeling lost or unsure, don't be afraid to reach out to your healthcare team, find a support group, or look for reliable information online. There are people out there who understand what you're going through and want to help.
And remember, this isn't the end of the conversation. There's more research happening all the time, so things are always changing. Stay curious, stay informed, and most importantly, stay hopeful.
Couldn't have said it better myself. This deep dive has been quite a journey. We've explored the science, heard personal stories, and really dug into this whole world of cannabis use among cancer patients. And while we've learned a lot, it's clear that there's still so much more to discover. So until next time, keep asking those questions and keep searching for answers.